You're live.
Okay, thank you. Good evening, folks. This is a convening of the Central District Health Board for Wednesday, November 17th, 2021. It is 5:00 p.m. I will introduce myself as a presiding chair. I am Betty Ann Nettleton, representing Elmore County, along with Representative Megan Blanksma. And at this point, I will call the meeting to order and take roll call by county, starting with Ada County. Dr. Young.
Jane Young here.
Raul Labrador. Dr. Cole. Boise County, Ryan Sturm.
Commissioner Sturm present.
Elmore County, Megan.
Megan Blanksma present.
Okay, and Valley County, Commissioner Hasbrook.
Commissioner Hasbrook present.
Okay, thank you, folks. We do have a quorum. So proceeding with our agenda, Director Duke, do we have any changes to the agenda?
We have no changes to the agenda.
Okay, under new business, we have Mike Kane on the phone with us, as well as Director Duke is here. I'm going to be turning discussion over to them after we proceed with motion for approval of our minutes from our October 17th, 2021 board meeting. So at this time, I would entertain a motion for approval of those minutes.
Madam Chair, this is Eld. I'll make that motion to approve those minutes.
Okay, thank you, Al. Do I have a second?
Yes, you've got a second. This is Jane.
Okay, thank you, Jane. Is there any additions or further discussion regarding those minutes?
No.
Hearing none, I'll call for a vote for approval, starting with Jane Young.
Jane Young, yes.
Raul Labrador. Dr. Cole. Commissioner Sturm.
Ryan Sturm, aye.
Thank you, Ryan. Elmore County, Representative Blanksma.
Megan Blanksma, aye.
Valley County, Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you, folks. Those minutes from that October 17th board meeting have been approved. And as I previously stated, I will turn that discussion over to Mike King and Director Duke at this time to talk about the opioid settlement agreement. Russ?
Sure, Madam Chair. So basically, the state of Idaho is entering into a national opioid settlement agreement with a couple of manufacturers and distributors who have been part of this long ongoing lawsuit. And we're very close to the end. And the deadline for the local agencies, including cities of a certain size, our counties, as well as the public health districts, will have the opportunity to participate. The amount of money, it's not been exactly determined because there's a couple of different variables, depends on how many counties, how many cities, how many health districts sign on, but approximately for Public Health District 4, we will receive $400,000 a year for the next 18 years. There are parameters on how the money can be used, which is in part of the settlement agreement itself, focusing on opioid use, misuse, risk factors, other substances that are commonly used along with opioids, as well as the mental health aspects. So we have until December 3rd. And that's the single purpose of the meeting tonight. And I'd like to turn over some time to Mike Kane to review the settlement itself and then be available to answer any questions before you vote. Mike?
Thank you. Hope you can hear me all right.
Yes.
Great. Thank you. So as Russ said, there is a national settlement of some, but not all, of the opioid lawsuits. The ones that have been settled are the Johnson & Johnson case and several distributors of opioids. So those two groups have settled. And what that means is the lawyers for all the entities, all the states and all of the local governments that are involved have put together a agreement as to distribution of the funds. And if I understand it correctly from the Attorney General, there's approximately $118 million coming to Idaho over the course of 18 years. And what the AG and the local government attorneys have done is they've come together to do an intrastate allocation of the money. And so before you is the actual agreement itself, which has the parameters of how the money is to be spent. It's quite broad, but obviously it's to either remediate or otherwise work with people who have opioid addictions, support law enforcement, support hospitals, medical providers, many different ways to spend the money. The agreement is that the state will get 40%, the local governments will get 40%, and the health districts of the state will get 20%. Of the health districts, because of population and other metrics which are agreed upon the national level, District 4 will get the lion's share of the money, approximately 1/3 of the health district share of the 20% over a period of 18 years. My math was it was going to be higher than 400. But that aside, what you should know is that there are other potentials for more money to come into the district. One of those is that if any local government chooses not to participate themselves, they have the ability to allocate their money to their individual health district. So we don't know what the local governments are going to do within our district, but if any chooses not to participate, they can agree to have you receive that money. The other thing you should know is that this document, this agreement, is going to be used as a template for future settlements. There are others, Pharma, Purdue, and other cases that are out there, and we expect eventually, probably within a year, there will be settlements on those entities as well. This agreement will be the template for future settlements, so it's possible that the money coming to the health district would be considerably higher, perhaps even double of the figure that Russ just said. In order to make this happen, you have to agree to sign 3 documents. One of them is a participation form as to the distributors. What that is essentially is a release saying that you, the district, will not sue these various distributors on your own. Similarly, there's another participation form that you will need to sign, and that goes to Johnson & Johnson. And for all intents and purposes, they're the same thing. What they are essentially is a release to Johnson & Johnson. And then there is a final form, the actual agreement to be part of this allocation. That is the 3rd document that you will need to sign. And basically with that, what we would do, assuming you decide to do this, we would get that information to the AG, and you're part of the settlement. I'm cutting a lot of corners, but I suspect you probably know much about what we're talking about already. So I'll stop and then answer any questions you might have.
Thank you, Mike. The floor is open for discussion or questions at this time.
I have one, Madam Chair.
Yes, Jane, go ahead.
Why would somebody not want to participate?
Madam Chair, some of the local districts, counties rather, and cities have a relatively low population. and they may choose to allocate the money to the health district where they may determine that the money may be better spent.
Okay.
Madam Chair, this is Al.
Yes, El, go ahead.
I know Valley County's already signed up for this and we're kind of looking forward to it. I think some of the money we're going to use in some of our existing substance abuse programs, like the local rock that we have near McCall. But we've talked about possibly even contracting with the health districts to do some of those things for us. And I kind of think that's a smarter way to go than to not be in the program and give it to your health district. The big issue is this is a lot like the Millennial Fund, the Tobacco Settlement Fund. It's very restrictive on where you can spend it. And we, immediately the discussion went to, alcohol abuse and marijuana abuse, and you can't use it for any of that. It's purely for opioids and that kind of stuff. So it may be kind of hard to spend the money, but I think we should go for it. I think it's only a small part of more companies that we're going to see down the road. Going to have to, fork out some funds too. So this could end up being a pretty good asset for budgets, but keep in the back of your mind that it's only for opioid addiction.
Thank you, El. Any further questions or discussion? Commissioner Sturm, Representative Blanksma?
I'm good.
No, I'm good too.
Thank you, Megan. I'm sorry, Ryan, I didn't hear you.
I'm good too.
Okay,
Boise County has already signed on to that.
okay, thank you. Russ, do you have any further comments before we call for motion for a vote?
I don't, Madam Chair.
Okay, at this time, I will entertain a motion to go ahead and sign these documents for this opioid settlement agreement. Do I hear a motion?
I'll second Jim's motion.
I need somebody to make the motion first.
Okay.
I-
I'll make the motion that we sign the opioid settlement documents.
Okay, thank you, Al. Second.
You don't. I agree. I second it.
Okay, thank you. Any further comments before we vote? Okay, hearing none, I'll call for a vote by county, starting with Ada County, Jane Young,
Jane Young, aye.
Raul Labrador, Dr. Colo, Commissioner Sturm,
Ryan Sturm, aye.
Elmore County, Representative Blanksma,
Representative Blanksma, aye.
Valley County Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you, folks. That motion passes, and we look forward to good things coming from this. That concludes our agenda for today, and our next meeting is scheduled for December 17th, a regularly scheduled meeting at 8:30 a.m. And so at this time, if there's nothing further, Russ, do you have anything?
Nothing further.
I'll ask for a motion for adjournment.
Madam Chair, this is El.
Okay,
Before I
Al?
make that motion, I would like to remind everyone that December is when you get your little jar of honey, but you have to show up to the meeting to get it.
Hey, I'll be there.
Make the motion, we adjourn.
I'll be willing to second that motion, but also remind Elt that there's little incentive for me since I'm allergic.
I'll take yours, Megan. Okay, thank
got her.
you. The motion has been made and seconded. Is there any further discussion before I call for a vote for adjournment? Okay, hearing none, we'll start with Ada County, Jane Young,
Jane Young, aye.
Raul Labrador, Dr. Cole, Boise County Commissioner Sturm,
Ryan Sturm, aye.
Elmore County Representative Blanksma,
Representative Blanksma, aye.
Valley County Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you. folks. And Mike, thank you for joining us if you're still there. We appreciate your input.
Yes, thank you.
Okay.
You bet.
Our meeting stands adjourned, and thank you folks again for your participation, and have a good evening. Thank you.
Happy Thanksgiving.
Thank you.
Yes.
Bye.